Walk down the health aisle of any grocery store, and you will find shelves dedicated to extra virgin olive oil. For decades, medical guidelines and popular culture have aligned to crown this single ingredient as the ultimate heart-healthy elixir. That reputation draws heavily on the romance of the Mediterranean diet. We picture generations of families hand-harvesting olives from ancient groves, assuming this traditional staple is the secret to their longevity. Yet, if you look for a large, fully independent clinical trial proving that isolated olive oil actually prevents heart disease, you won't find one. That trial does not exist. The bedrock of our modern dietary advice rests largely on observational assumptions and cultural nostalgia, rather than independent clinical proof. When researchers do cite clinical evidence for olive oil, they almost universally point to the PREDIMED trial, a massive Spanish study that shaped global nutrition policy. In 2018, the New England Journal of Medicine retracted the original PREDIMED paper. Auditors discovered that the randomization process had failed for roughly 21% of the participants, compromising the integrity of the baseline data. The study was also heavily funded by the olive oil trade. The intervention oil was donated by an organization called Patrimonio Comunal Olivarero, a group specifically created to promote Spanish olive oil exports. With the most famous trial in the field compromised by methodological errors and deep industry ties, the scientific basis for the health claims requires a much closer look. To bypass the industry-funded clinical trials, we can look at long-term independent population data, like the massive dietary cohorts tracked by researchers here at Harvard Medical School. This chart tracks cardiovascular mortality based on fat sources. Replacing saturated animal fats with olive oil significantly drops the risk of death. But when compared against other standard plant oils, the two bars level out. There is no statistical difference in heart disease or stroke. Genetic studies confirm this. Mendelian randomization, which analyzes genetic variants to isolate cause and effect, shows that having naturally higher levels of circulating oleic acid, the main fat in olive oil, provides no causal protection for the heart. The population data reveals a replacement effect. The health benefit comes from removing atherogenic animal fat from the plate rather than any active, unique property of the olive oil itself. Broad population statistics capture one part of the story. To see the immediate biological reality, we have to look at what happens inside our blood vessels in the hours immediately following a meal. In controlled clinical testing, consuming a meal containing 50 grams of isolated olive oil causes flow-mediated dilation, a key measure of arterial health, to drop by roughly 31%. Because the oil is a refined, emulsified fat, it absorbs rapidly into the bloodstream, creating a massive surge of lipid droplets called chylomicrons that flood the circulatory system. Stripped of the fiber and cellular matrix found in whole olives, these microscopic fat remnants easily penetrate the arterial wall, triggering oxidative stress and an inflammatory response in the endothelium. On a mechanical level, ingesting a bolus of isolated liquid fat acts as an acute stressor to the vascular system, actively contradicting the idea that it functions as a cardiovascular medicine. Proponents often point to a secondary prevention trial called cardioprotective as proof of olive oil's superiority. To understand the results of any clinical trial, you have to look at the control group. A study can make an intervention look highly effective simply by testing it against a very poor alternative. This pie chart illustrates cardioprotective's low-fat control diet. It contained 32% fat, with protein heavily sourced from animals. Even against this weak control, the olive oil diet struggled. In patients with a specific genetic risk allele, triglycerides remained elevated on the olive oil protocol. Outperforming a diet heavy in animal protein and fat suggests that olive oil is a better alternative to a standard Western diet, but it falls short of proving independent efficacy. There are dietary interventions in the published scientific literature that have successfully arrested and even partially reversed the progression of coronary artery disease. Quantitative angiograms from Dr. Dean Ornish's lifestyle trials documented clear regression of plaque blockages in the arteries of patients with severe heart disease. Dr. Caldwell Esselstyn's clinical series produced similar outcomes, nearly eliminating recurrent cardiac events in highly adherent patients. Both of these successful medical protocols mandate a strict, whole food, plant-based diet that explicitly excludes all added oils. To achieve the highest standard of clinical success, the actual reversal of heart disease, The science requires removing the exact liquid fat the public has been encouraged to pour freely over their food. The final argument for consuming extra virgin olive oil is its concentration of phenolic antioxidants, compounds that do show genuine activity in laboratory settings. This scale compares the caloric cost of getting 500 milligrams of polyphenols from blueberries versus extra virgin olive oil. To get the dose found in 51 calories of blueberries, you'd need roughly 45,000 calories of pure liquid fat. The independent evidence points to a single conclusion. Olive oil is a comparatively benign substitute for saturated animal fats, but it is not an independently active cardiovascular medicine. Health is not found in calorically dense, processed extractions. The most effective way to protect the heart is to seek nutrients directly from the complex whole food plant matrix.